When giving your child children's Tylenol, it's important to follow the dosing instructions carefully. Be sure to use a product that is meant for children and use your child's weight to find the right dose on the product package. If you don't know your child's weight, you can use their age. For suspensions, shake the medication well before each dose. Some liquids do not need to be shaken before use. Measure the liquid medication with the provided dose measuring spoon/dropper/syringe to make sure you have the correct dose. Do not use a household spoon. For rapidly dissolving tablets, chew or allow to dissolve on the tongue, then swallow with or without water. For chewable tablets, chew thoroughly before swallowing. Do not crush or chew extended-release tablets. Swallow the tablets whole. For effervescent tablets, dissolve the dose in the recommended amount of water, then drink. It's important to take children's Tylenol as soon as the first signs of pain occur. If you wait until the symptoms have worsened, the medication may not work as well. Do not give this medication for fever for more than 3 days unless directed by your doctor. For adults, do not take this product for pain for more than 10 days, 5 days in children, unless directed by your doctor. If the child has a sore throat, especially with high fever, headache, or nausea/vomiting, consult the doctor promptly. And if your condition lasts or gets worse, be sure to tell your doctor. If you think you may have a serious medical problem, get medical help right away. If you notice any unusual effects, it's important to contact your doctor or pharmacist right away. Your doctor has weighed the benefits of this medication against the potential risks of side effects. While most people do not experience serious side effects, it's important to seek medical help if you notice any signs of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing. If you experience any other effects not listed here, make sure to contact your doctor or pharmacist. Remember, you can report any side effects to the FDA in the US or Health Canada. Before giving children's Tylenol to your child, make sure to talk to your doctor or pharmacist if your child is allergic to acetaminophen or has any other allergies. It's important to let them know if your child has a history of liver disease or regularly uses alcohol. Also, be cautious if the product you are using contains sugar or aspartame, especially if your child has diabetes or phenylketonuria, PKU. If you are pregnant or breastfeeding, consult your doctor before using this medication. As always, it's best to consult with a healthcare professional before giving any medication to your child. And remember to carefully follow the dosing instructions and ask your doctor about the optimal timing for giving children's Tylenol. It's important to be aware of possible interactions with other medications. Always consult your doctor or pharmacist before starting, stopping, or changing the dosage of any medicines. Some products that may interact with children's Tylenol include ketoconazole and levoketoconazole. Additionally, this medication may interfere with certain lab tests, so it's important to inform lab personnel and all your doctors that you are using this drug. If you suspect someone has taken too much children's Tylenol and is experiencing severe symptoms such as loss of consciousness or difficulty breathing, it's important to call 911 immediately. Otherwise, contact a poison control center right away. In the US, you can call the local poison control center at 1-800-222-1222. Canadian residents should call their provincial poison control center. Symptoms of an overdose may include nausea, vomiting, lack of appetite, sweating, stomach pain, extreme fatigue, yellowing of the eyes or skin, and dark urine. Acetaminophen, the active ingredient in children's Tylenol, does not cause stomach and intestinal ulcers like some other pain relievers. However, it also does not reduce swelling like those other medications. It's best to consult your doctor to determine if children's Tylenol is the right choice for your child. Children's Tylenol can be used to reduce fever and relieve minor aches and pains. The recommended daily dosage for children is based on their weight, so be sure to follow the instructions on the packaging. It's best to take children's Tylenol with food to help prevent stomach upset. And always be sure to follow the recommended dosing schedule to ensure the best results. If your child is taking this medication regularly and misses a dose, they should take it as soon as they remember. If it is close to the time of the next dose, they should skip the missed dose and take the next dose at the regular time. They should not take a double dose to make up for the missed one. It's important to store children's Tylenol at room temperature, away from light and moisture. Avoid storing it in the bathroom and make sure to keep it out of reach of children and pets. When it comes to getting rid of expired or unneeded children's Tylenol, don't flush it down the toilet or pour it into a drain unless specifically directed to do so. Instead, consult with your pharmacist or local waste disposal company for proper disposal instructions. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.